Hey guys, so starting on videos on specific things, I'm gonna do patient assessment using the HABC method. I'm gonna break that down real quick. So HABC is gonna be hemorrhage, airway, breathing, circulation. That's a military variant. Compared to your ABCs, there's also MARCH. We can get into those later. But start off with your patient assessment. Quick, simple, and dirty for traumatic injuries. You show up on your patient, your age. If you have severe bleeding, you want to take care of that with a tourniquet, direct pressure. Obviously, arterial bleeding is going to be the most life threatening. So for me, I'm super simple, super easy. You got to keep the blood in your patient to keep a viable patient. So H right out of the gate. If it's bleeding, stop it. Move down to airway. If you don't have an airway, you're not going to have a patient. So BLS over ALS all day. See if your OPAs, NPAs can be used effectively, your non-rebreather, get your O2 sats up, and at the end of the day, your patient's going to need O2 if they've lost blood. Um, so treat your patient's signs and symptoms, right? If they're cyanotic around the lips, if they have poor cap refill, if they're shocky, if they look like they're going into shock, they're going to need O2. Breathing and circulation are going to go hand in hand. You want to make sure your patient's breathing adequately, whether it be pediatrics or an adult. You can gauge that by the distress your patient's in, right? We all know what it looks like when you're having a hard time breathing. Address that. Use a BVM. Bag them to get adequate breaths. You got to do that after you get a patent airway, of course, right? Go hand in hand. Get a tube that can move air and then move air effectively. Circulation, make sure you have radial pulses. I'm a big fan, civilian and military EMS. I like to check radial pulses bilaterally, both sides. If you have a radial pulse, you're perfusing, right? If you have no equipment, if you're on the side of the road, whatever happens, if you have to do a quick HABC assessment, that's the way to do it, right? Super simple. Keep air moving in and out, keep the blood in, and treat your patient. There's a lot that you can do without having all the high speed stuff and trying to make ALS stuff, right? BLS saved lives. When it comes to your patient assessment, you address the HABCs and then move up from there. But if you are very good at the basics of addressing that, then your patient's gonna have a better outcome and you can move forward with that. So just real quick, we'll get into MARCH later on. ABCs obviously is civilian old school. Just your airway, breathing, circulation. Tap the H onto it. Changing times come with changing techniques. So hope this helps. Like I said, we'll put more out. I just put out a poll. Got a few people that wanted some more detailed specific subjects. So let me know what else to go over and what be military, civilian, or bystander.